everybody. Welcome to today's Facebook Live. I'm Dr. Sally Foote. Today I wanted to review the recent JAVMA article. This is a Journal of the American Veterinary Medical Association, November 15th edition. It just came out. And there was an article in here on the evaluation of associations between owner presence and indicators of fear in dogs during routine veterinary examinations. This study was conducted by four professors, four investigators at the Department of Population Medicine at the Ontario Veterinary College in Guelph, Canada. So, the objective, as it says, goes through all the right up here. The objective was to evaluate the influence of owner presence on behavioral and physiological indicators of fear during routine physical examinations. So I'm not going to go through all, of the article. If you're a veterinarian and you get your JAVMA, you read it. I know, it's hard, excuse me, with all the things we get, but you can look this up online. I've linked it in the post right before going into this Facebook Live, so you can read it even if you're not a veterinarian or you're not a member of AVMA. So here's some of the high points. First of all, we have 32 dogs total. So there was a group of 16 dogs in the owner present group and a group of 16 dogs where the owner was not present. And it was the same type of, exam room examination area that they used at Guelph. They did not have a different kind of area from, the exam room area when the owner was just not present. So they're using the same room, so the environment is the same between both groups. So you have a total of 32 dogs. Now, we had 28 owners because there were a few owners who had more than one dog. So that's, that can add a little bit of a effect for the dogs getting an exam. I noticed it when I was in practice that sometimes the client would actually bring the buddy dog, the second dog, to help the dog who needed care that day to be less upset or less stressed. That was because they had companion separation anxiety. So just to let you know, there were 28 owners, primarily female owners. This was voluntary sign up for people over the age of 18. So there was no recruitment or conscious recruitment of trying to make sure we had the same representation of male or female gender for the owner. Now, what was measured for the behaviors was vocalization, lip licking, yawning, changes in posture, decreased postures, the dog who's starting to cower. Avoidance behaviors, this could be just pulling back, turning the head away. And then lastly, escape behaviors. So escape behaviors would be the dog actually trying to jump off the exam table or, actually pull away or get away from, the owner. It was from the examiner and the handler. It was a range of breeds. So they had large breed and small breed dogs on this. So I think that very much, represents if there might be any kind of breed and age, characteristics, age as well, range of ages. So just kind of in a summary, here's what we found for the behaviors. So vocalization was increased when the owner was absent. So when the animal was, the leash was handed over to the handler, and the dog was led into the examination room and no owner was there. Okay, so the dogs were, and I don't believe in here it went into real specific description, if it was whining or if it was barking, but the dogs were vocalizing when the owner was separated. Now, when there was lip licking present, and I want to see, I think there was more when the dogs were taken away, as compared to yawning. Now, yawning was more frequent when the owner was present. And it's thought because the other behaviors of the dog was showing either relaxation, or it was thought that perhaps yawning was an appeasement behavior or some kind of social communication, with the owner. Now, the owners were sitting across from the dogs, and they were allowed to hold the dog's leash, so the leash was still attached to the dog's collar. The owner, I guess, could touch the dog, but not get in the way with any kind of handling. Fourthly, posture, that decreased in posture, that happened when there was abdominal palpation, lymph node palpation. And that actually was the same whether or not the owner was present. So the crouching down, the reaction of cowering. Now, it was not that descriptive to say if there also was any ears down, tail down. Just said dropping the posture, okay? But that was equivocal whether the owner was present or not. This other behavior, avoidance. So avoidance, kind of pulling away, turning away. That increased during head and mouth examination. And that was also the same whether or not the owner was present. Lastly, escape behavior. So this is a dog actually really pulling away, stepping away, scampering, struggling, away, skittling away, if you will, from the handler and the veterinarian when they're doing auscultation of the chest. And that was the same whether or not the owner was present. So some of the thoughts on, the one thought that was shared in the write-up was about escape behaviors during auscultation. May have been because there's less restraint. When we're just listening to the heart and lungs, because we're not actually touching them, that would be considered non-invasive, if you will, not as much contact. That the animal, then the dog, could pull away more, actually literally try to scamper away or jump off the table when you're reaching with that stethoscope. And I thought that was pretty interesting, because putting the stethoscope on the chest is not anything painful, and it's not as, much touch-oriented as palpation, and certainly head and mouth exam, because I had a head and mouth examination. Now we're around these sensory organs, and of course the teeth, if there might be any inflamed teeth, etc. So I thought, that was pretty significant, and I'm just going to share maybe some of just my thoughts. Okay, this is Sally's opinion here. I'd be interested to hear in the comments or seeing your comments what some of you think of these things. Now, the 3 physiological parameters that were measured was the axillary temperature, heart rate, and respiratory rate. Now, the temperature was slightly lower if the owner was present. So the dog's baseline temperature was lower. That is probably, oftentimes that occurs if there is less adrenaline rush, the heart rate is lower, and they're not doing as much pacing, not as much moving around before even getting into, the exam, or as you come into the exam room, they may be moving around, and pacing. The heart rate, actually, that was interesting. It was a little bit sex dependent. The female dogs had a higher heart rate whether or not owners were present as compared to male dogs. On the heart rate, let me check this really quick here. Sorry. Here we go, physiological measures here. Owner presence also affected heart rate through an interaction with the dog sex. So, so when there wasn't an owner, the mean heart rate was 112 beats per minute compared with male dogs without their owners at 85 beats per minute. That's really a pretty significant difference. And then male dogs remained relatively consistent with their heart rate regardless of the owner's presence. And now they also, so I don't see a note here about, so the female dogs, I guess, then had a lower heart rate when the owner was present as compared to when the owner was not present. So we're seeing a bigger difference in the female dog for her heart rate, whether or not the owner's there. Now, respiration rate, that one said there was no significant difference in mean respiratory rate between dogs with the owner present and dogs with the owner absent. And there was a note here, in addition, owner contact, including physical contact, verbal contact, both or none, with the dog during examination was not significantly associated with axillary temperature. Well, anyway, back to respiration. So there really wasn't a big difference, and they had noted that because sometimes they were panting, like panting was just always going on. So these are what the findings are, and so basically what they were stating is that because we were seeing some of the behaviors decreased when an owner is present. These upper ones, this is where we're seeing more of the reduction in vocalization, lip licking, yawning, when the owner is present as compared to when the owner is not present. We're also seeing a difference in body temperature, some change in heart rate, which is sex dependent, whether or not the owner is present. So the article is stating that the owner's presence does have a benefit or has a potential benefit to be, to reduce the stress on the dog. And of course, more studies need to be done, and I completely agree with that. This is one of the first studies on really trying to piece out with a standardized examination. 7 minutes was the examination time, the amount of time given for the examination. Charting also physiological measures besides, behavioral measures and that. So I think it's really great that we have this here as a place to start with. Now, in one of the veterinary forums, one of the veterinary Facebook groups actually, that I belong to, and actually also through the American Veterinary Society of Animal Behaviors forum and on another group discussion, the impact of curbside care, curbside care during COVID-19, how is that affecting the stress level on our patients? Are we seeing dogs or cats more stressed or less stressed, the same level? What's what? And what we're getting in here across the board is some veterinary practices feel the animals are a lot less stressed without the owner present. And that may very well be true, because sometimes it depends on the owner's behavior, and that was also acknowledged in this paper, that if the owner is stressed, the owner is anxious themselves, then the animals are going to respond to that. They may get more anxious. So, there was, it would be pretty complicated to add an assessment, I think, of the owner's behavior on top of this study. So, yes, it's true. Through curbside care, we may see some animals actually do better, be less stressed when their owners are not in the exam room with them because of the owner's stress level. Now, we did not, also anecdotally or in discussions, the practices that are certified in some of the programs, such as low stress handling certification by Cattle Dog Publishing or fear-free certification through the Fear-Free Corporation, have seen where the animals are not stressed. They're staying like as happy as they usually would be, whether or not their owner is there, because they seem to be already, they know the staff, they have a relationship with the staff, and the staff is trained in how to approach and how to modify the examination for this particular patient. Some, of course, animals are getting more stressed for curbside care, where I am also seeing where some veterinary practices are having bites to their staff because taking them away from the owner and so on is increasing the stress on the patient. So I guess all I'm trying to say is that, one, it's not a blanket recommendation to say that keeping the owner in the room is always a good thing. Most of the time it usually is, in my experience, yet there are times when it is not. And really, and I think this is good too, to also really think about, especially veterinary professionals, that there's going to be an impact on the physiology of this animal based on their emotional experience. The brain and the body are together, just like I always say. And now, this is not going on to, well, what did the animal learn? What are they like the next time they come in? But that's that last memory is a lasting memory effect. Meaning, if let's say the owner is present and the dog's heart rate is a bit slower and, they're more cooperative for care, even if they may have had some of these behavior signs here, and when the owner's not present, we have vocalization, and we have a higher temperature, then we would know, we would put that on the medical record, keep the owner present for the exam if we can. And if we can't, then we should try tools such as FaceTime or WhatsApp or, video chat directly to the client waiting outside or in the car so that we can keep the owner on the video. I have seen where animals are like, oh, it's like my owner is really here. So we need to use those tools to help make it, the next best thing. Or maybe it's up to you, allowing some item from home. Maybe something that might carry some of the owner's scent on them, as long as it's not going to open us up into any kind of infection with COVID. I know rates are rising all over the place, and we have to still be very, very careful. This virus is hot. That's all I can say. Now, The third thing I do want to say that I feel limits this study and really does need to be, if they had done this, I would feel a lot better about really commenting on the benefit of owner being present or not. And that was that the same dog only had one condition. We didn't have the same dog come in for an exam one day with the owner present, do all this measurement, and then have that same dog come in another day without the owner present and compare. A comparative study like that, I think, would be really important. A few last things I would like to say is, I don't know what the staff's training for handling was. It wasn't commented here if, as a standard of the handlers training or the veterinary examiner's training, they were fear-free certified or low-stress handling certified, or had reviewed or followed, an exam protocol from any kind of speaker like myself or, others for, demonstrating knowledge of approach and so on. I mean, one thing that is good is the order of the examination was always the same. I don't know, though, which way they started with the exam. Did it start like nose to tail? Which frankly, that's what they taught us in vet school. Go from the nose to the tail. We'll tell you what, starting with the head and the mouth is the most stressful area to start an examination. Do not start from nose to tail. So, this is a starting point. I'm glad we have it. I'm really glad we have it. Not all of us will maybe agree with some of the findings based on our own personal experiences. Yet, I personally did find that for the majority of dogs, they were less stressed and more cooperative for care. They would readily accept the food reward or any other kind of verbal praise and show a decrease in their signs of anxiety. And it did affect this. I mean, I had some animals that would be at my office with a heart rate of, 110, 120 for their general physical exam. And maybe we found a problem. I had to refer them to the specialty referral center. And they go to the referral center, and now they're getting heart rates of 150 and 160. And then they may hear a murmur at 150 and 160 that I don't hear with a heart rate that's slower. Well, is that murmur real or not? So, okay, maybe do the ultrasound, etc. And then, if everything came back normal, that's good to know. Yet, this is where getting all of us in the veterinary profession and shelter care and also any other trainers and, groomers and handlers together, unified in learning proper approach, learning how to change the space, and record that for that animal. This is this animal's particular plan for handling. It can be called the emotional record. I used a system I made myself called the Bella Behavior System. But this is particular to this animal, and we need to know it for this animal, and we need to use it every time. So I hope you have a chance to read this, at least, consider it. I'm very thankful and grateful to the University of Guelph in Canada for doing this. I look forward to other studies coming out. And lastly, I'd like to hear what you guys think about all this. What's your experience been with curbside care, now, and how anxious these dogs are or not? Are they better or are they worse? What do you guys think about the same dog when the owner's there or not? What have you seen at times, in your practice? So thank you very much. Just a last reminder, this Sunday I will be doing my live presentation here at the Bella Behavior Learning Center on Feline Handling Lab. It's going to be live streamed at, I think it's 2:45 p.m. I've been putting the links up for the Illinois State Veterinary Medical Association's website, with the registration. So you can get 3 full days of CE and, learn a lot. And I look forward to hopefully you guys can attend that and learn about handling cats or anxious cats and that. So thank you so much. Everybody stay safe and stay healthy. Bye-bye.